A really important question is, what is the best way to deal with infertility in women? And remember, this is always dependent on what is the source. If you don't know what it is, it's hard to fix. And so you have to have the right testing before you decide on the right treatment. And for testing, again, you want to say, are there sperm? Where do the eggs stand? And that's a function of quantity and quality. How old is the woman, as well as how many eggs are in the ovary? And that's something you figure out through anti-Mullerian hormone, or AMH, or an anti-follicle count where you look at the ovaries. And then, are the tubes open? And as well as, is there a receptive place for the embryo in the uterus? And then that guides how you go about treatment. Now, if the problem is simply low sperm, some people go with just insemination. If sperm weren't finding the egg and you increase the number of sperm to find the egg, that goes a long way. If the woman was never releasing eggs and you do ovulation induction, which is to stimulate going from 0 eggs in a month, or 0.1 to 1, that goes a long way. For many people, though, with unexplained infertility and other forms of infertility, it's a combination of increasing the number of eggs and the number of sperm through a blend of what's called superovulation for extra eggs and insemination, again, to increase the sperm in the reproductive tract. And that is often a low-cost, low-tech way of revving up fertility. The challenge for that is a lot of people end up either being very wimpy in their stimulation, they didn't get very many eggs, or they are making it very expensive, and you have to look at dollars spent per pregnancy achieved. So this is something that's often individualized. IVF, in vitro fertilization, can be super powerful, because if you are getting 20 eggs in a month, putting the sperm with them, and then all of a sudden getting a lot of embryos where you can find healthy ones and put them back, that goes a very long way, and that's particularly important for tubal disease where sperm and egg don't naturally meet. However, if you're doing IVF and there's diminished ovarian reserve, people are running low on eggs, and you only have 2 eggs, you know what? IVF, you have to do 10 IVF cycles for the person with 2 eggs to get the same yield as the person who had 20 eggs, who is otherwise identical. And so often IVF is a poor approach for the people who are running out of eggs. Not to say that it can't be the right fit, but you have diminishing returns from it relative to those with more robust or healthy ovarian reserve. So the point is, find out where you are and also talk to the practice. What are their pregnancy rates with doing nothing, and how does that apply to where you are personally? What are their success rates with oral medication insemination, and what are the success rates with in vitro fertilization? There are other options, but often the core 3 that I was just doing, the spontaneous versus oral medication insemination versus IVF, are often dollars spent per pregnancy achieved, some of the most efficient routes to getting people where they want to be, though that's not without exception. Thank you for watching. Share knowledge so others are empowered, and good luck on your journey.